Dr. McCann here, and this is going to be a brief video on how you might be able to get payment help for your weight loss injections. So first, the Ozempic, which is the semaglutide, and the Mounjaro or tirzepatide were originally approved for type 2 diabetes. So your insurance should cover these injections if you have type 2 diabetes. And so this is something that you would want to talk to your primary doctor about if you're not on these medicines with type 2 diabetes, and see if you would be a potential candidate for these injections. Second is the Wegovy or semaglutide was recently FDA approved for overweight or obese individuals with a history of heart disease. And Medicare did say that they would start covering in their Part D coverage for the Wegovy specifically or semaglutide for overweight or obese individuals with heart disease. And the tirzepatide or Zepbound should shortly also follow and get this indication. However, you still have to meet the criteria for this drug to be covered for these indications. And again, right now this is just Medicare, but generally private insurances follow what Medicare does. So hopefully that's what will be in this situation also. So what criteria do you have to meet? You have to have a BMI of 27 or more, and you have to have heart disease. And heart disease in this study was defined as, number one, a history of a heart attack, number two, a history of a stroke, and number three, symptomatic peripheral artery disease. So you have to have a BMI of 27 or more with one of these risk factors or one of these criteria for heart disease. And so if your BMI is 26 and you've had a heart attack, it will not be covered. You have to meet the criteria. And again, right now this is Medicare, but generally private insurances follow Medicare's lead on what they will cover and for what indications. And a third, of course, is for weight loss. So most insurances do not cover weight loss drugs or weight loss services. But if your insurance does cover weight loss drugs and weight loss services, that is what the Wegovy or semaglutide and Zepbound or tirzepatide was also FDA approved for. However, you can't just want to lose a few pounds. If your insurance covers weight loss services, you can't just want to lose 10 pounds and expect these drugs to be covered. You still have to meet the criteria. The criteria is a BMI of 27 or more with at least one risk factor, which include heart disease, high blood pressure, high cholesterol, or obstructive sleep apnea. Or you have to have a BMI of 30 or more. So you still have to meet the criteria even if your insurances cover weight management services. So let's say you have private insurance and it doesn't cover weight loss drugs. There still might be payment help for you. And let's take a look here specifically at Zepbound's website, and the semaglutide or Wegovy also has a similar program. But if you have private insurance, not government insurance, and you meet the criteria and your insurance does not cover weight management services, you may be eligible for what amounts to almost half off your monthly subscription. And the website says this is good for 11 months. Now, obviously the caveat is you might not be able to find the drug. They're running out of it. But this is one thing you can check into to see if you can get a lower payment on your prescription. But again, it can't just be for 10 pounds. You have to meet the BMI criteria regardless of your percent body fat. And yes, this happens all of the time. It is very easy for women, specifically, and men, to fall into the obese category for your percent body fat, but have a BMI of less than 27. Your percent body fat is not looked at all in these indications. It is strictly your BMI. So BMI of 27 or more with one or more risk factors, or a BMI of 30. In conclusion, we all know these drugs are expensive and we all know they're hard to find. You may have options for some payment help with the above indications, but again, you have to meet the criteria that the drug was approved for.